Green Spring. Today is Tuesday, March 8th, 2016. I'm Fran Duval, your host for today. Happy to have as our first guest the medical director, Dr. Sonia Bethel, and so happy to see you again.
Thank you.
On a non-medical issue.
Thank you very much. And it's International Women's Day.
And it's International Women's Day.
Yeah.
I don't know, we need to celebrate that somehow today. Say Happy Women's Day to all the women you meet.
Absolutely.
I think that's a good way. Especially the men should say Happy Women's Day. Okay,
Yes.
well, we'll get off that. Okay, so what's going on at the medical center that you would like to give us updates on or whatever?
Well, we're just going to talk briefly about the care path process. And for anyone who doesn't know what that is, it is the process by which a resident may maintain their outside primary care office, but they register with the medical center so that we have information available about their health history, okay? So what that basically entails is that you call the medical center and say, okay, I'm a new resident to Green Spring. I will be keeping my outside physician, but I would like to have a care path visit. And so then our front desk folk will say, okay, there's a packet of information that we need to get to you. You can either stop by the medical center and pick it up, or we can send it to your cubby. So that information includes the name of your outside primary care physician, any specialist offices that you visit on a regular basis. It has contact information for family members and folks who might be making medical decisions in your behalf if you're unable to do that. And so all of that would then become part of an electronic medical record. And that is very important to have, because in the event that you had a need for emergency services, and you pull your cord and security comes to your apartment, that electronic information from that record can then go with you to the facility where you'll be receiving your emergency care. So if we don't have that information, there either would be nothing going along, or the information could be incorrect. So it's advisable that you keep it updated. So even after you have your initial care path visit, then we recommend that you sort of update it on an annual basis, or when there have been any significant changes. What we sometimes find is, let's say on the advanced directives, you may have chosen someone to help make decisions for you, and then that person becomes incapable for whatever reason, either because of death or change in their cognitive status, or move out of the area so that they're not convenient enough to help you with that. So those, that's an instance where you want to then say, okay, well, now I'll need an appointment where I can update those records and make them current. So that's a little bit about care path, and we definitely encourage anyone who is a resident here on campus to do that, so that you will have that information. So if you're wondering, well, what does the medical center have to offer? So we have primary care doctors. In fact, we have 5 physicians. We have nurse practitioners. We have a mental health professional. We have a podiatrist, and that's the team of professionals, medical professionals, who are available to help you. On the average, when you make an appointment at the medical center, if it's an initial appointment, whether it's for a care path visit, or you actually want to have your primary care with us and it's your first appointment, that's a 60-minute appointment, okay? And also for a pre-op evaluation, that's also a 60-minute appointment. Or if you are coming for a physical exam, so that's 1 whole hour that you have with a provider, okay? Then any other appointments, just routine appointments, follow-up appointments, annual wellness exams, those kinds of appointments are generally 30 minutes, okay? On a rare occasion, there might be a brief 15-minute appointment if it's something that's very simple and straightforward, like let's say a cold or a urinary tract infection. But as a rule, 30 minutes are the standard, and then on occasion it could even be a 60-minute appointment. So that kind of is a little different than what you have in the industry, you know, outside of a geriatric practice. So we think of that, you know, as a positive. And the providers that we have are, you know, are experienced in taking care of issues that relate specifically to geriatrics. You know, there are some illnesses and disease processes that occur across the age spectrum, but then there are others that tend to be more prominent in seniors. Let's say like arthritis, like, you know, stenosis in your spine, which is a specialized kind of arthritis, like dementia, for example, more advanced congestive heart failure and those kinds of issues. So our providers have many years of experience in practice and can really sort of focus on issues that, you know, relate to geriatrics.
I need to say to you, so today this show will be like 6 times on the air. For those people who are new and don't watch the show, do they get this information in their welcome pack?
Yes.
Through sales?
Yes.
Okay. Having moved in 13 years ago, and in fact, I don't think, the medical center was in operation.
Yes, it
but
was.
you know, I don't recall.
Yeah. I can't imagine why not.
Whether I got that information in a pack or whether I just knew it instinctively,
Sure. Yeah.
having had friends here already using the medical center, you know. So
it is a part of the new patient package.
Okay.
So it has a little blurb about the medical center. It also talks about the health portal, which is the technological way of managing your health care. And if you, let's say if you visit a local hospital or even, you know, some other offices, there is a portal where you can log in on a secure basis and get information, whether it's lab reports or x-ray reports or requests for medication refills, or, you know, those kinds of things can be managed through the health portal. And if you need help with that, our front office staff, you know, will be available to help you with that. So you or a family member could certainly have access to the portal. And there's a PIN, a personal identification number, that is required, and then you can get those services taken care of online.
speaking of the front desk persons, they're also women.
Yes.
We didn't mention them.
We did not. We have
Shame on us.
3 women at the front desk, and the medical assistants who, you know,
Manage
help
it, yeah.
put patients in the rooms and draw blood and, you know, obtain X-ray results and those kinds of things. All women except one. So we have a very female-dominated medical center.
Well.
One of our physicians is male, and one of our medical assistants is male. But everybody.
I didn't want to sidetrack, but it just,
It's
when
fine.
you mentioned the front desk people, I thought, ooh, we didn't mention them.
Absolutely.
So what else then?
Okay. Well, we try to prevent health problems like we offer, you know, vaccinations. So obviously, in flu season, we certainly, you know, recommend that you get your flu shots. And it's not too late. If there's anyone who hasn't had one, you can still do that. Vaccines against shingles, vaccines against pneumococcal pneumonia, tetanus, all of those kinds of, excuse me, vaccines are available through the medical center. Sometimes, excuse me.
Take time to have a little sip of water, doctor. That's what you would recommend to one of your patients, I'll bet you.
Yes, that's true. Thank you very much. One of the other services we provide is getting blood tests or lab done for specialist office. So any lab that's necessary can be done through our office. Our medical assistants draw the blood, collect the specimen, then it's sent to LabCorp, and then the result comes both to our electronic record, and then it can be sent directly to you know, an outside physician. So that's the service that we provide. Yeah. One of the things that I think is very helpful that you and I were talking about earlier was the ability to check your INR right there on site. So for anybody who's on Coumadin, you know what an INR is. And there are quite a few people who do take Coumadin. And so we can do a finger stick, give you an immediate result, and have someone manage your dose on site rather than having blood drawn and waiting, until the following day to get some advice about that. Right. So that's a service that we provide as well. We do wound care. Oh, I'm sorry.
Well, you didn't mention the specialists that come in either.
Okay, no, I didn't, but we do. We have specialists that come at varying times during the month. So weekly we have orthopedics who's there on Wednesdays. We also have we have cardiology who's there weekly. And Dr. Bixel for neurology, who's there weekly, and they all see patients in the medical center proper. Now, there are other specialists who come at varying times who are in the Parkview Medical Suite, and those include audiology. She's there on Fridays. We have a dentist who's there, I think, just twice a month. We have a urologist, which is surgical kidney disease. We have a nephrologist, which is medical kidney disease. And we also have, I'm forgetting someone else, but we have about 8 total specialists that visit.
I just thought I'd mention that since you're giving all this information.
Yeah.
And
yeah,
it really is a one-stop shopping here.
And we can do X-rays.
Oh yeah.
So we have an X-ray technician who visits on Wednesday morning and Friday mornings. But if there is an X-ray that's needed at other times, depending on what it is, it could possibly even be done in your apartment.
Yeah.
So that's another service that we're pretty proud of. So
you coordinate all that. It's really great. Yeah.
Yeah, and that's helpful, and we get a result usually the same day. So certain sonograms and certain X-rays can actually be done in the apartment.
When you were shuffling your papers, you had 2 sheets. Did you want to cover something else or not?
Well, I was going to also mention...
I didn't want us to get out of time here.
No, that's okay. Also mention that the patient load per provider is relatively small compared to outside practices. So we try to limit that total load to about 400 patients. So if you remember when you're in outside practices, you might have 1,000 or 1,500 patients assigned to one doctor. So having a small group of patients means personalized care. So that's something to think about. The other thing we're pretty proud about are same-day appointments, which differs from what you have in outside practice. If you find that you have an urgent need to be seen, I would say probably in 95 to 98% of the time, you can get an appointment that same day. Now, it may not be with your assigned provider, but you will see either a nurse practitioner or an MD on the day that you call in, to be seen. And we do recommend you call rather than just stop by, although you can do that as well. You can, stop by and ask to be seen, and we have that available for you.
I had other questions, but I think we're getting... are you finished with what you... One of my questions was... Go ahead. There's no different doctors at Garden Ridge, right?
No, our doctors cover Garden Ridge as well.
You cover that as well. Okay, that's what I wanted to make sure that everybody knew that.
Yes.
Yeah, okay.
So the nurse practitioners are predominantly assigned at Garden Ridge, but the doctors all have some days that they go to the rehab units, then they go to assisted living, and they go to the long-term care unit. So the same group of professionals provide care.
So that when one moves over from independent to there, they more than likely will see, at least occasionally, the doctor they had here on independent.
Yes, that's exactly right. So we stay busy, and we're available on call after hours and on weekends, and so
I've used it.
There's a lot to be done.
You know what, time is up, but I thank you so much. And
You're welcome.
You were just refreshing our memory for those of us who've been
Yes.
here a while, but I hope new people will take it to heart and make sure they register. It really is important if you ever have to pull the cord
Yes.
to have that electronic information. Thank you, Dr. Bethel,
Absolutely.
for coming on.
You're welcome.
Today is Women's Day, right? So I bet you we're going to do something that deals with women in the next segment. Stay tuned.